Thank you. Okay. So before I delve into the specifics of the study itself, I'd like to go over some brief background information. So in 2015, the FDA changed some of the labeling regarding MR-guided focused ultrasound treatment of fibroids in order to include some younger patients who are typically deemed or not deemed family complete and who wish to preserve their fertility. So the objective of our study was to evaluate the efficacy of MR-guided focused ultrasound of symptomatic uterine fibroids, specifically among this new subset of patients that meet these requirements. So in multiple recent studies, there has been a mean age of participants mostly over 40 years old, with patients under 35 often as low as 16%. So for our study, we had a total of 90 patients who received MRgFUS treatment. We lost 22 to follow-up, so a total of 68 between May of 2016 to December of 2017 were interviewed by phone in order to determine any changes in their symptom severity or any alternative procedures that they had. So once the changes in symptom severity were recorded, NPV, as well as average fibroid volume and age at the date of treatment were recorded. And at that point, multinomial logistic regression was conducted in order to assess the relationship among all of those variables. So as you can see, of the 68 patients who we did interview, we divided them into 3 groups by age. So we had 10 patients who were under 35, 37 patients who were 35 to 45 years old, and 21 patients who were over 45 years old. So onto the results, we had a total of 68 patients, so 36 of those reported an improvement in their symptoms, while 17 or 25% reported no change, and 15 or 22.1% reported worsening of their symptoms. We delved a little deeper and looked at average fibroid volume by age group specifically, and we found that in the under 35 age group, they had a much higher overall fibroid volume compared to the other age groups at 378.9 cc's. So continuing from there, we looked at which patients went on to have any alternative procedures. As you can see, we had 3 from the under 35 group who went on to have myomectomies. We had 4 from the 35 to 45 age group, as well as 4 from the over 45-year-old group go on to have an alternative procedure, and there was an overall reintervention rate of 16%. So looking at NPV versus outcome for all of the participants, we saw that there was a statistically significant relationship that showed an increasing NPV was associated with improved outcomes when compared to worsening outcomes. We also found a statistically significant results in that increasing the fibroid pretreatment volume was more likely to be associated with improved outcomes after the treatment. We found that there was not a statistically significant relationship between age and outcome, as well as specifically in the under 35-year-old group, we didn't see that there was any significant relationship between NPV and outcome. So now I'd just like to go over 2 cases, both in the under 35-year-old group. So this patient is a 33-year-old who was experiencing dysmenorrhea and who wished to preserve her fertility. She had a total fibroid load of 162 cc's, with the largest being 141 cc's. So in the T2 screening and the post-contrast screening MRI images, we can see that there are hypointense and hypoattenuating fibroids, and we can see that in the post-contrast, post-MRgFUS treatment image that those fibroids are now necrotic, and she went on to have an improved outcome and a 98.3% NPV. This next case, unfortunately, did not have the same outcome. There's a 34-year-old female who came in with originally a 541 cc fibroid, which was reduced to 385 cc's after 1 month of Lupron and then focused ultrasound treatment. Unfortunately, this patient came back with recurrence of symptoms, and we found that there was regrowth of viable tissue, as you can see in the follow-up image. So in conclusion, a majority, or 52.9% of the total patients reported an improvement after MRgFUS treatment. Although we didn't find any statistically significant increase in odds of reporting any improvement versus no change as NPV increased, we did see a significant increase in odds when comparing NPV to worsening outcomes. So a total of 75% of the patients with an NPV of less than 50% went on to report worsening outcomes. We had 11 patients total go on to have an alternative procedure, 10 of whom had worsening symptoms and only 1 of whom had no change in their symptoms. And specifically in the under 35 age group, we found that there was no association between increasing NPV and any improved outcomes. So a future consideration would be that potentially many patients who are under 35 who have these symptomatic uterine fibroids are unaware that MR-guided focus ultrasound is a treatment option. It's also possible that it might just be the prevalence in each age group, or if they're more likely to attempt pharmacologic treatment initially. But I think that further studies with a focus on this family incomplete age group will provide a better understanding for treatment efficacy. Thank you.
Any questions? Thank you for the presentation. I think that under 35 age group is really interesting, and unfortunately we don't have a lot of data on it, but from our data, I think it was really interesting that they had larger fibroids than the older patients. So I think there's some inherent genetic difference of the young women who get fibroids. They get bigger earlier, maybe they're less responsive. There's something different about these fibroids, and I welcome any other comments from anyone who has further experience with this young age group? No? Again, I think we hope to accumulate more data and take a look at this age group in particular, so thank you.